welcome to our special show, Living Long and Healthy with COVID Vaccination. I'm Gargi Rawat. Now, the show seeks to address concerns that you may have regarding the COVID vaccines and living in this new normal. Because do remember, the risk of COVID infections continues even as restrictions may have been eased in many parts of the country. Cases are rising once again, and vaccines are the only way that you can protect yourself. Vaccines is the only way this pandemic is going to end. So we have doctors with us to answer any questions and concerns you may have. Today we have with us Dr. Sharad Kumar, professor at the Eras Medical College, Lucknow, and Dr. Niraj Raghani, cardiologist and director at the Zenith Heart Hospital in Amravati. Thank you so much, doctors, for joining us and sparing the time to answer all our questions. I'd like to start with you, Dr. Sharad Kumar. Now, one of the questions that many people have, and it's just been a year of living with this pandemic, but as these vaccines have been developed in such a short time, and it's been so soon that we've had vaccines in place, are they safe and effective?
Yeah, that's a very important question that is being echoed in the minds of several persons. But let me assure you, it is really very, very appreciable for our scientists and the persons who had worked day and night to develop this vaccine. I think we should be indebted to their effort. This vaccine, I am really confident that this is a very safe vaccine, not only effective but also safe vaccine. You see, had it not been for those many trials, it would have been released several months before. It has gone several trials, rigorous trials, and this has therefore been approved by the special group of the experts which are there in the WHO, and this has also been approved by the European Medical Council, and this has also been approved by our agencies like ICMR and DCGI. So we have to have confidence, and we are sure that this is going to not only work, but this is also going to be pretty safe for most of us, if not all. And let me tell you here why I'm saying so, because there is a surveillance period which is there for every drug. But fortunately, to my knowledge, no serious adverse effects have been reported so far. So I'm quite confident that this will come out to be a winner in the long term. And there is no reason why we should question the efficacy and safety of this vaccine. Both the vaccines that are being made available to our people, they are quite safe and quite effective. So please, let me assure you, all of you, please go ahead with the vaccines. You would appreciate that we had been waiting for so long for the vaccines to be here, and now once the vaccines are here, there is no reason we should avoid them. We must go for them.
All right, so do go in for Covishield or Covaxin, whatever vaccine is offered to you. Dr. Niraj Raghani, now people are asked to, after they get the vaccine, they made to sit there for half an hour. So what are the common and minor side effects that have been reported so far by people post-vaccination?
So we do all know that now we are facing the crisis of COVID, and the only solution to this is mask, social distancing and vaccination. So I suggest and request all the people around me and the public that please don't be afraid of vaccination, don't be afraid of the side effects associated with vaccination, and go ahead for the vaccination. There are some side effects of the vaccination, as any medication can have, any vaccine can have, and the most common side effects are a local tenderness or pain at the site of injection. There can be some redness or lump or swelling at the site of injection. That pain will start around 6 to 12 hours after the injection and may remain for 2 to 3 days. There can be some mild fever or body ache or COVID-like symptoms post-vaccination. Maybe some headache, arthralgia, that is joint pain. These are all mild symptoms and they will go away within 2 to 3 days. Rarely there can be severe reaction and redness of the body, and like you can feel of shortness of breath, that is called as anaphylactic reaction, but that is very, 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 very rare. So don't be afraid of it. Please go ahead with vaccination. These some common side effects will come and will go away. So nothing to worry about.
All right. Well, the big news now is the variants of coronavirus. There are these foreign variants. Some cases have been found in India, the UK variant, the South Africa and the Brazilian one. There's also a double mutant variant found. Some samples have been found in Maharashtra. Dr. Sharad Kumar, does the vaccine protect us against these new variants of the virus?
Yeah, so far the data that we have received is quite reassuring. And it has been found that the vaccine is effective against these variants as well. You see, mutation is a normal phenomena, and every virus or every microbe that often gets mutated. This is a normal phenomena. This is not particular to the COVID virus also only. So this is not something which is very new. And the mutations, the minor mutations, they keep on occurring. And these vaccines are capable of taking care of those minor modifications in their genome, that is mutation. So the currently available vaccines are effective, and there is no reason to get panicky about it. Yes.
Right, Dr. Niraj Raghani, now will the side effects of the vaccine be any different for people with a heart condition or cardiovascular disease? You spoke about, the regular sort of side effects there are, but do these people who have these conditions have to be extra careful?
So let me clear you that the post-vaccination, it will be nothing different for heart patient as compared to the general population. Only thing, because you are a heart patient, post-vaccination there can be some time the blood can get thick and say some clot formation can be there, but that is also very rare. So I suggest to all the heart patients or patient at risk to continue your blood thinners. Don't stop the blood thinners. Otherwise, the side effect profile in heart patient as well as for non-heart patient is totally same. No special precaution. One more thing, please drink a lot of water. Adequate hydration keeps your body's blood quite well maintained, thin, so clot formation risk is reduced. And take your medications properly. Do control your blood pressure and diabetes, because any infection, whether it's post-vaccination symptoms or any real COVID, they get patient get more affected if they are having uncontrolled sugars or uncontrolled blood pressure. So nothing to worry for the cardiac patients. Please go ahead for your vaccination. One more thing I would like to add, that if you have undergone recent angioplasty, avoid vaccination for a month or so post angioplasty, because you have stent there and you're taking blood thinners. So after 1 month you can go for vaccination to avoid any complications of stent thrombosis.
All right. So, in fact, it is people who have these issues who should go ahead and get protected from COVID the earliest that they can. Dr. Sharad Kumar, now we do know, there's a gap between the doses of the vaccine, and that was recently increased between the first and second doses of a Covishield vaccine. Now, why is that?
Yeah, whenever antigen is introduced into the body, there is a reaction into the body, and we get production of antibodies. Now, this is the basic principle of taking any vaccines. Now, this is a known fact that once we take an antigen or a vaccine, there is a response in the antibody production. Now, over a period of few weeks, the response gets down, and there is a fall in the titer or the level of antibodies. Now, once we take a booster dose or a second dose, we get an exaggerated response in the antibodies production. Now, this is a known fact, I would say again, that once the gap between the two doses is increased, the response of the antibody may dip down in next few weeks. But once the booster dose is given, the response is much larger and it lasts much longer. And that is the reason that we go for an optimum gap between the two doses. And this is the practice which is observed in all the vaccinations, may it be DPT vaccination. We know that we give a gap of 1 month between the 3 doses. And like the vaccination for tetanus, we give a gap of 6 weeks and then 6 months. So there is an optimum gap which has been designed for every vaccination. So here in COVID vaccination, for Covishield, initial gap of around 4 weeks was recommended. But as the data has poured in recent data, it has been found that if we increase the gap to maybe 6 weeks or maybe up to 8 weeks, the booster response is better. And therefore, a guideline of the Government of India has been issued on 22nd of March that for Covishield, we can increase the gap from 4 weeks to up to 6 weeks. And therefore, we can guide the system. The body can be guided to make a better antibody response. And so therefore now, as per current guidelines, we can give a gap of 4 to 6 weeks between 2 doses of Covishield. And the gap for Covaxin is still recommended as 4 weeks.
All right, and coming back to the issue of people with, heart issues, Dr. Niraj Raghani, about, one question that we get very often is whether people who have pacemakers, is it safe for them to go ahead and get vaccinated?
Pacemaker has nothing to do with our blood flow system. It is just a electrical current generator to let the heart beat, and patient with pacemaker should not be worried about COVID vaccination. Pacemaker is nothing to do with the vaccination. There will be no different side effect or any complication post vaccination related to pacemaker. It will be like general population. They can suffer from mild pain and fever and body ache like any other patient, and no need to worry about. Please do check your pacemakers every year, and keep a watch on your heart rate and blood pressure and sugar level.
All right, well, thank you so much for answering that. And with that, time for us to slip into a short break. We'll return and answer more queries that you have regarding the vaccination. Stay with us. Welcome back to our special show, Living Long and Healthy with COVID Vaccination. We have doctors answering all your queries and doubts for you. Dr. Sharad Kumar, I'd like to ask you, is it important for people, who have diabetes to check with their doctor regarding their medication before they go in for the vaccine?
Yeah, we always recommend good diabetes control is definitely a sort of vaccine, you can say. If a person has poor diabetes control, he is more prone for all infections, including COVID. So a good diabetes control is mandatory for a good health. So persons should not be careless about their diabetes control, and they should continue to maintain good glycemic control. But as far as any choice of medications is concerned, there is nothing to choose about, and there are no recommendations to avoid any particular medications or to start any particular medications. So good diabetes control and a continuous consumption of the medications is that what is required.
All right. Now, Dr. Niraj Raghani, there have been instances of people, post-vaccination experiencing heart attacks. What is the reason for this, and is there any linkage?
It's not because of post-COVID vaccination or COVID people are passing away because of heart attack. Do you have data of heart attack patient? Actually, heart attack is a bigger problem than COVID, because COVID has come all together in the whole world. We are seeing many patients immediately. In a short span of time, we have millions and trillions of patients. But let me tell you that heart attacks is an epidemic. It happens daily and daily. We are seeing many patients in the pre-COVID era as well as in the COVID era. So heart attack numbers have not increased in COVID, or it is not related to COVID, but patients are coming more and more and getting less facilities because of the overburden of the medical system because of the COVID pandemic. But there are some incidences that after COVID infection, there can be hypercoagulability or vascular thrombosis. That means there is a blockages, thrombus formation, clot formation in the blood vessel that can increase the risk of heart attack or any other attack like brain attack or occlusion of limb artery, which can cause pain in the lower limb or upper limb in the hand. So these complications do occur in any infection, any inflammatory stage. Any patient prone to heart attack, if they get any stress on the body, whether it is COVID or non-COVID, they are prone to heart attack. So keep your cholesterol under check, keep your sugars and blood pressure under check, and take proper medication and advice from a cardiologist, from a heart doctor, to avoid such kind of complications.
All right. Dr. Sharad Kumar, there have also been instances of long COVID, after recovering. So what are some of the post-COVID symptoms that people have been exhibiting?
Yeah, what the data is suggesting us that there is a good number of people who get a prolonged weakness for lasting for several weeks. You see, there is a whole spectrum of the COVID disease. There are a good number of patients who will develop no symptoms. Then there are certain persons who will develop maybe just a little malaise and maybe mild fever for a day or two. Then there are persons who develop a sort of a viral disease. There will be a febrile period or a sort of fever for say around a week's time. Then there are certain persons who develop a prolonged illness. And then unfortunately there is around 10% of the population of the patients, they develop a prolonged COVID illness. And these people developed a prolonged inflammation of the lungs, basically. And these people develop this problem, and this problem can last for several weeks' time. And even up to 12 weeks, the problem may continue to be there. And then there is a gradual recovery. Most of the persons, they recover gradually and completely. But certain persons, again, I would say they developed a post-COVID prolonged illness. And there sometimes very few persons, they require a ventilatory support also. But this is very minuscule in terms of overall COVID patients who get affected with it. So I would say there's a wide spectrum of the illness that is there. But certain times, yes, the persons may continue to develop problems which can last up to several weeks.
All right. Well, thank you so much, doctors, for, patiently answering all those questions, clearing all those doubts that many people have. And do remember, the message from the doctors is if you're eligible, then go ahead and get your vaccine. It's the only way we can defeat this pandemic. Thanks so much for watching. Goodbye.